Assalamu alaikum, hello and welcome to the Health Show for our second live show looking at the coronavirus pandemic. Today we're extending the show to 90 minutes due to the high volume of calls we received last week from you watching at home. With the pandemic causing disruption around the world and enormous concern within the community, we'll be helping to keep you up to date in this special programme every week. To help you understand what you should do from a health perspective to avoid catching the virus or indeed from passing it on, we'll also be looking at the current healthcare crisis from a spiritual aspect as well. Now, last week we reported that here in the UK, more than 3,000 people had been infected and there were 144 deaths. But now, just 7 days later, sadly it's been reported as of this morning here in the UK alone, there are now more than 11,000 people affected. That's 11,000. And sadly, there have been now a total of 578 deaths. Now, worldwide, there are now more than 500,000 people affected with the virus and over 24,294 deaths. And that's recorded so far. And I say so far because the health authorities say we are still a few weeks away from the peak of this pandemic. Now, to remind you where to get the best advice and most accurate and up-to-date information about coronavirus, also known as COVID-19, you should visit 111.nhs.uk/COVID-19, and you can see that on the bottom of your screens. If you feel you have symptoms such as an ongoing cough, especially a dry one, a high temperature, shortness of breath, then you should first of all self-isolate and then call NHS 111. I'd now like to welcome back General Practitioner Dr. Imran Gohar to come back on the show again this week, and he's joined by Sheikh Abu Hanifa, a renowned sheikh. Gentlemen, thank you so much indeed for coming on the show. Second time?
Yes.
Absolutely brilliant. Thank you so much for being here, and Sheikh, a warm welcome to you too.
Welcome.
Now, before we talk to our guests, let's take a look at an animation which explains what the coronavirus is and where it comes from.
Coronaviruses form a very large family of viruses that principally infect animals. They can, however, occasionally infect humans, causing symptoms similar to the common cold and mild flu, and they can sometimes result in respiratory complications in people vulnerable to infection. Coronavirus infections are often not diagnosed as they're benign and tend to heal spontaneously. The viruses jump from human to human through the air, via an infected individual's secretion, or after contact with contaminated objects, especially in the winter. 2 coronaviruses have led to serious epidemics in humans, causing death. SARS, a worldwide epidemic which lasted between November 2002 and July 2003, and MERS, identified for the first time in the Middle East in 2012. In 2019, a new deadly coronavirus emerged in China called SARS-CoV-2. The main symptoms are fever, coughing and breathing difficulties, as well as an upset stomach. SARS and MERS viruses originated in bats, then an intermediary animal. In the case of SARS, the masked palm civet, sold and eaten by humans in China. And in the case of MERS, the dromedary. At present, there's no specific medicine or vaccine for these viruses.
Well, we've just heard the news, literally just a couple of hours ago, that our Prime Minister Boris Johnson has the virus. And I think it really just brings it home, you know, the fact that anyone and everyone can be affected by this. Doctor, have you been in this last week? I can imagine, like the rest of the NHS, just, you know, manically busy.
Yes, absolutely. I think the biggest concern is the anxiety over this virus, because everybody is vulnerable for it. And the new statistics we are getting, actually a lot of young people are getting it as well. That's why the public message is to stay away and stay at home if possible, and keep the distance of 2 meters plus if possible. Make sure you're wearing a mask when you're going out. Make sure you wash your hand, wear gloves when you enter into the house, when you're going out, when you're touching something, and try not to in the first place anyway. So yes, it is increasing day by day. And as far as, I hope not, but what we're hearing is that it's probably going to go up in the next coming weeks as well.
And that's very much what we were led to expect as well, wasn't it? And Sheikh, if I can come to you, from a spiritual point of view, people's faiths are being really tested at this time, and I'm sure you're getting a lot of questions, from people in your community.
Absolutely. Everybody's worried. And no one is immune, against this. So it's the panic that people have, which leads them actually to a lot of stress, not knowing much about it. But I think this, program will enlighten a lot of people.
And we're going to be coming to you quite a lot during the show,
of course,
to talk a lot about the faith perspective,
definitely,
and how it's interrupting people's daily lives,
absolutely,
their prayers, and
absolutely,
of course we've got Ramadan coming up fairly
absolutely,
soon as well.
yes,
and I know many of our callers will be calling specifically
yes,
for that. And actually, on the subject of calls, we will be taking your calls in the second half of the show, so do stand by for that. We'll let you know when that happens. So, Doctor, if we can just get back to the basics again. We hear all the news, we hear about all the people who are getting it, we hear tragically about the deaths and things, but I think it's important to get back to the real basics about what the virus is and what we should be doing as an individual and as a family.
As your slide showed earlier, it's a respiratory virus, basically, like a flu or any other upper airway virus, which is spread by, as shown on the TV, by coughing, sneezing from respiratory droplets. This virus especially is highly infectious, and it goes and it's being transmitted to others very, very quickly. That's why the advice is to wash your hands, to keep your general hygiene up more than usual, so that you cannot pass to others. And that's how it grows, basically, by personal contact. And that's why this self-isolation is so highly, in place throughout the world now, because they've noticed that if you self-isolate people, the viral will have its life cycle and it's going to die. And in that way, even to the people who are infectious. The tragedy is the people who are infected and got worse, basically. In that category, there are mostly there are patients with underlying conditions, chronic conditions, for example, some serious respiratory condition like COPD, asthma, serious heart condition, transplant patients. They are the one who are vulnerable, because if let's say if they get this virus, then it can be quite serious for them because of their low immunity. On top of that, the people who are taking immunosuppressant drugs, they're also high risk as well, because their immunity is already low. So it's a new challenge which we never encountered before.
And I know we're going to get a lot of questions, particularly about the conditions that people have. And obviously one of the big things is social distancing, and we should say to everybody watching at home that here in the studio we are maintaining that 2 meters, and also we've been making sure that the crew here have been doing a fantastic job making sure everything's wiped down and that we're doing everything we possibly can. Because there are people who are having to work, such as the broadcasting industry, and, people who are in those situations where they can't avoid having to leave the house because of the work that they're involved in. There are a lot of things they can do, as we've done here in the studio as well, to help, aren't there?
Yeah, if first of all, the proximity to each other, that's very important. If you keep a safe distance, then even let's say somebody had a cough or cold or something, then at least you've got a safe distance for that. The other thing is, yes, if you can possibly wear a mask, you can wear a mask if you're going, to work or coming into close contact with someone. Washing hand with soap to begin with. If you don't have a soap, use a alcohol gel or spray, whatever is available, because it's known that it kills that virus. And also keep your place where you're working, for example, your desk, your computer. Whichever you touch most commonly, make sure that when you start your work, you wipe it properly, and when you're leaving it, you wipe it as well. The staff, when they're working, make sure if they can, they wear gloves, try not to touch the surfaces and stuff. Minimum people, if they can work, if some staff out of 10, let's say, at a workplace, 5 can work from home, then they should try to do that so that it increases the distance and social
you
contact
just
as well.
Keep people apart, and of course that's particularly challenging, isn't it, when it comes to prayers and things like that, isn't it? Within the community, there's obviously a lot of concern about how people can continue their faith in a way that they want to, given these challenges.
Indeed. I mean, I wouldn't say we've been taken by surprise, but, to the best of my knowledge, majority of people have never experienced such thing. This is a new experience for everyone. So, panicking will lead people actually to be narrow in their, thinking and their views and so on and so forth. So when the instruction start being given by people in authority, people did not actually digest it in the beginning, not knowing the seriousness of it. But as they went along,
as something somewhere else, wasn't it? It wasn't necessarily seen as something on your doorstep.
Absolutely, absolutely. Even Rasul sallallahu alaihi wasallam, our Prophet used to say, hearing about something is not like seeing it.
Yeah.
When it comes very near in your own community, then this is when you know the seriousness of such thing.
And I did hear someone say that actually, if you are feeling that sort of anxiety, maybe turning to your faith is actually a particularly strong way to channel your energy.
Absolutely. And this is a test. Allah subhanahu wa ta'ala been testing us with, with the bounties which was in our hand. The highest bounty here is health. We've never valued it. It's only when you when you are in danger, when you are exposed to such thing, then you value whatever you had in your hand, and health, even other bounties. People now when they are rushing to shops, we had all this food. It was there in front of us. We have never known the value of it just because it was accessible.
Yeah.
Now.
And there's no question the world will be changed as a result of this. We, all of us in our lifetime have never experienced anything like this. So this will be completely life-changing. It'll be very interesting to see how we are as humanity, if you like, after this is actually finished. But I want to come back to what's happened within the last week and where you feel we are now in terms of the virus. We heard about, Prince Charles, the heir to the throne, getting COVID-19. We've heard today about, obviously, the Prime Minister, a lot of celebrities, a lot of people we're hearing more and more and more getting this. What's the status do you think we are at the moment?
I think we are, at the moment, looking at the... it's not an old virus that's keeping that mind. It started from January mainly, when we observe it in China. Looking at the history where it happened, Iran, China, Italy, and other European countries and other countries, I think we are on the upward trend, actually, and I think probably we'll see more increase. That's why this time is very crucial. Actually, people should observe strict social isolation, if possibly, and so that we can reduce the spread of the virus. And it's doable. It's not necessary that if it happened in Italy, that it will happen here as well. If we have more, that's the whole point. We need to learn the lesson, actually. And we should do right things which maybe the other societies didn't do.
Let's do a few bits of myth busting here. It's a part of the show I always enjoy doing, because there's, you hear lots of people talking, well, what about this, what about that? So let's just cover a few things. So first of all, if you think there's any chance you might have some form of symptom, well, first of all, actually, before we even get to that, what should everybody be doing if they are not working, if they are not involved in work that they cannot do at home, they have to go out? If they are able to stay at home, what should they do?
Well, staying at home, at least it's your own environment. It's a safe environment, because if, let's say, I'm self-isolating myself, nothing's coming from out or nothing is going from in outward. So it means that you hardly unlikely to get a virus, because it's transmitted through human to human basically right now. So so that's highly unlikely that you will catch it. So the other issue, the biggest issue, is actually people who are not self-isolating. Because you're going out, you're meeting people, you're touching the surfaces, you're driving, shopping and things like that. Basically.
Okay, well, let's talk about shopping, because we've had a lot of advice there from the government. Now, here in the UK, the online delivery services are pretty much maxed out. They're not taking any more customers. Obviously, if you are a customer of that, you should absolutely be using it. But what about going to the shops? What are the rules on that? What are the suggestions on that?
Again, it's a basic rule. Keep the distances. So don't let all the customer at once like we used to do. We're not, should we have a safe distance? And I think that's shops' responsibility as well. Don't let a lot of people coming in. And I'm sure I've observed yesterday, lots of places they have somebody standing outside and they're making sure.
And in fact, my advice to anybody is go later. I went into a high street supermarket last night. It was about 7:30. There was hardly anybody there. And what people forget is, of course, stores are coming in throughout the day. Yeah. It's not just overnight and it's all full in the morning and it goes. They're coming and replenishing throughout the day. So, people don't need to have to panic on that. But I want to come to prayers very quickly. Yes. Sheikh, what's your advice about, how to pray and how you do that in a position of self-isolation or just social distancing?
I mean, as the doctor was saying, home is a safe environment. Everyone at home. And I think this is an opportunity for the families actually to get to know one another, maybe on one hand. And the other hand is, performing all this, rituals and acts of worship together with the family. I think that is a good opportunity. And this is the time that we should come to know Allah subhanahu wa ta'ala. Rasul sallallahu alayhi wa sallam used to say, our Prophet Muhammad sallallahu alayhi wa sallam used to say, know Allah in the time of ease. He will know you in the time of difficulties. So it is part of our relationship with God.
Are there any compromises that people are having to make regarding their faith and prayers during this time, which again, even my knowledge of the Quran says that actually there's a lot of flexibility, yes, in circumstances like this. What are the sort of issues that you've come across?
Performing prayer in congregation, for example, because of the situation at the moment. Almost all mosques are, closed, and Islam and Islamic law do really not only facilitate but encourages people, in fact, to value health, to value other people's, life. So it's not about you; it's about, others as well at the same time. So this is one of the things that Islam do really encourage.
Excellent. And coming back to the health aspect, Doctor, another myth is this whole thing about exercise. What's permissible, what's not permissible when it comes to being outside? Obviously, if people have gardens, that's great because they can get out and, have some form of exercise in the gardens. But if you don't have a garden or access to a garden, what kind of exercise is permissible?
Well, I think all kind of exercise is permissible. The whole risk of going to the gym or public places where you meet other people is same, basically, like in a shopping center or any shops where you touch the surfaces, where you come in very close contact with the people. So if, let's say, you live somewhere where there is nobody live around there, people are not on the street, and if you got some open space, some green belt or something, and you see that there's not many people there, then of course you can go and do some exercise there.
And that's the real key, isn't it? It's using your own initiative to see if there's nobody else there, then fine. But if you see people there already, then maybe try and find somewhere else.
I think again, adhering to the principle of distancing and cleansing is the key, actually. So that should be applied in any scenario, and you can get an answer, actually. It's not about going to certain shops or not the others. It's about how you're going there. Yeah. It's not about which exercise you can do or which you can't do. It's how you do it and where you do it, basically. So we have to change our lifestyle. Normally people go to the gym, people go to public places. In certain neighborhoods they have exercises in parks and things where general public touches the. So that's a bit risky. Anywhere where there's a public traffic is slightly risky. People are touching things, and that's where the virus is spread.
And avoiding that touching. I know we're going to have a lot of questions about this, and if you would like to ask your questions, we're going to be having our phone in after the break. We're going to have a short break in a few moments' time, and then straight after that we'll be able to take your questions. And again, a reminder that we're only taking phone calls from people within the UK because of the sheer volume of calls. But if you are calling from overseas, then please do email us at healthshow@islamchannel.co.uk, and that way you'll be able to get through to us. You'll be able to get your emails to us. You can see that email address on the bottom of your screens there. So do email us then, and then the team here at the Health Show will give me those questions. So don't worry, we will make sure they get answered as well. And just before we go to break, again, trying to see that there isn't an awful lot of positive news at the moment because we're not yet at the peak of the pandemic. But you touched on something earlier on which I thought was really interesting, the fact that if you actually take responsibility and stay at home and you do almost go into self-isolation even if you don't need to, that's actually the best form of protection you can give.
Absolutely, because in that way you're coming into least contact. So that's why, that's a message actually from every country we are hearing, which been through this before us, is that any unnecessary human traffic need to be stopped actually, either as a tube, buses, offices. So the least people going out, the least chance of spreading the virus to the others, and that's the only way to stop the spread as well. Again, there are certain people like doctors, people for media and other places which are doing a very important job. They have to go out and do their job. For them, they have to make sure that they're there to the same principle of washing hands, keeping the distance.
So that applies to all of us. Thank you very much indeed. We appreciate that. Now, as always, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed today, of course, being coronavirus. Now, do join us again after this short break when we're going to be opening our phone lines and taking your calls. We'll be right back. Welcome back to the Health Show, a coronavirus special. Now, according to the NHS, the coronavirus can make anyone seriously ill. But as you've heard earlier on, there are some people who are at a higher risk. You can be at a higher risk if you have had an organ transplant, having certain types of cancer treatments. Maybe you have severe lung conditions or asthma, or maybe a heart condition, as well as being pregnant. And again, to find out more about all those conditions, visit 111.nhs.uk/COVID-19. And again, that's 111.nhs.uk/COVID-19. And you can see that on the bottom of your screens. And I urge you again, please do look at that website, because a lot of the questions that people have are actually all there, and you don't necessarily maybe have to call your GP. You can actually go straight to that. And also maybe don't listen to some of the myths that are out there on the internet. Just follow the advice on that website. But there is something that we can all do, and that's washing our hands properly for 20 seconds. And again, I say properly. Let's take a look at how we should be doing it.
Washing your hands is one of the easiest ways to protect yourself and others from illnesses such as coronavirus. You should wash your hands for about 20 seconds. Wet your hands with water. Apply enough soap to cover your hands. Rub your hands together. Use one hand to rub the back of the other hand and clean in between your fingers. Do the same with the other hand. Rub the back of your fingers against your palms. Rub your thumb using the other hand. Do the same with the other thumb. Rub the tips of your fingers on the palm of your other hand. Do the same with the other hand. Rinse your hands with water. Use your elbow to turn off the tap. Dry your hands completely with a disposable towel. Use the disposable towel to open the door to leave the bathroom area.
Some really, really good tips there. And actually, one of the ones interesting is the thing of using the paper towel to open the bathroom door, because just in case other people aren't being, as fastidious as you are. Now, we've just had a question which actually came in on the email, and they were asking about, there's a call from Nigeria, an email from Nigeria, and they were saying the whole thing about face masks. They're seeing some people wearing them, some not. There's a lot of conflicting evidence about face masks. What's your take on it?
As far as the research is concerned, as far as I'm aware of what's been come from China and other parts of the world, there are certain type of face masks which give you a full cover from coronavirus. But having said that, those masks are very hard to get, even on NHS actually. So general public, majority of them probably will not have that mask. So in that case, I think they should use a mask of any sort which they can get. In this kind of scenario, I have a feeling that people should use whatever can minimize the infection transmission actually. So it will be better to use a mask than not use a mask actually. So yes, if you can get an ideal mask which is covering the corona, fair enough, but likelihood is you probably will not get it. So use whichever mask is available and do the other measures as well. So at least you can't transmit to the others actually, and that's how you can stop the transmission. But I would say yes, the masks which you use traditionally are not the best one for that, but it is better than nothing.
Mm-hmm. Okay, great. We've just had a couple of emails come in. One from Atik, who said, "Is this a punishment from God?" And another call came in saying there's apparently a comet, C19. Is this anything to do with it? Now, I'm not sure if you're an expert on comets or not.
No, I would
certainly, maybe there is this thing about the faith. And we heard it from last week on a serious note, that some people do see this as a message from God, as some form of punishment. What would you say to that?
This concept of whether it is a punishment from God and so on and so forth, we say it doesn't serve us at this point at all. It is facing the Muslims. Mecca is closed now, the house of Allah. Medina, we've been actually suffering from it. Those who are saying, well, it's a punishment from God. Why would God punish those who are close to Him? Why would He close His house? This is a serious illness that is covering the whole, humanity, the whole earth. Let us deal with it, even with the teaching of Islam. And Islam is based on a very important formula, which is لا ضرر ولا ضرار. Do not cause harm to yourself or cause harm to others. So unnecessary debates whether it is a punishment from God, and we say, look, don't divert from the reality. The reality is that might lead many people actually to think that they are, superior, that they are better than others, and so on and so forth. We say this is an illness. And in the concept of illness, even Rasul sallallahu alaihi wasallam, when he was asked by his wife, Aisha, he said, okay, avoid it. Okay, in case if this faces, people, whoever will be patient and keep himself at home, God will give him the reward as a matter.
Well, thank you for making that really, really clear.
Definitely.
We really appreciate that. We've got another call coming. This is Mohammed Aslam from East London. Good afternoon to you. What would you like to ask?
Good afternoon. I just very shocked for this problem with coronavirus, and we doesn't think about all around in the world what's last couple months the problem going on, Palestine and India. There is a put on curfew as well. People doesn't go anything. United Nations never do nothing anything to good for him. This is the people praying in a home without food, inside door, locked inside in India, Kashmir, another part, Delhi, Bombay, all around in the world. And United Nations doesn't do anything, try to help, try to negotiate, stop. It's all fixed up, but people pray now, and Allah and God, He feel that we receive like punishment as well. How many days He feeling locked down inside home? Same like we are. We are shut, and I'm ashamed of this country of all Muslim. all Muslim countries, shame of them, only part of only Turkey compared to all other countries, no one part of saying to put raise on hand against what's going on. But Saudi Arabia, he look after Hindu people as well, which is unbelievable of God. He's doing for very bad, and United Nations, he doesn't do nothing. And America, George Bush as well, I'm not against to all American people and English people all around the world, but what's the government he doing, the policy, is look like attacking of Muslim no one help. Why we put on all Muslim country, United Nations joint? It should be off. Separate part, not United Nations, which one
Mohammed,
only European Union.
Mohammed,
he doesn't
thank
try
you.
to help.
Thank you very much.
He doesn't try to help around in the world, which one going on. We should be nation to look after each other.
Mohammed,
I hope you understand where I'm coming from.
Mohammed, if I can stop you, there, Mohammed, and I really appreciate your call, and you've made a really valid point. What I should say is that much as many of our viewers, and we may or may not agree with you, that I think we're probably entering into the world of politics and maybe something beyond something that we can deal with here at the Health Show. But what I will do is I'll point one particular aspect of what you said there about the difference between, say, Muslims and Christians and other faiths. We won't get into the whole United Nations and different governments, because I think that's possibly a different forum for that. But this question about the different faiths, now my understanding is that this is affecting everybody throughout the world equally. I don't see any discrimination between any different faith in the way that it's either been handled or, for that matter, in terms of people being affected. What's your take on it, Sheikh?
Okay, I would just mention 2 points. If Muhammad actually were establishing his point by saying, look, at Mecca is still open, Muslims are still enjoying, okay, others are suffering, you would say, well, okay, you made your point. But Muslims are suffering, before anybody else, which shows you this is, a crisis. It is, an issue that is, facing human being, the humanity.
And we should say that every, not just mosques, but every place of worship of every faith has also been closed as well. So it's not individual faiths or anything.
At all. This is an illness.
Yeah.
Let us deal with it as an illness. Allah is, if you are saying, well, Allah subhanahu wa ta'ala created it, okay, let's say that Allah subhanahu wa ta'ala wants us, actually, the Muslims to wake up before the non-Muslims. So we shouldn't be too materialistic by saying, you know what, this is a punishment from God to, to others. We've been suffering from it. In fact, today, Muslims, like Iran is the second country after China. Okay, and other Muslim countries are suffering from it.
And we should really say, as you said before, I think, Sheikh, is that we shouldn't be distinguishing at this moment in time between faiths and different peoples.
Completely.
This is a human crisis.
Absolutely.
Let's just take another couple of calls, if we may. Okay, so first of all, hello, good afternoon.
Hello, good afternoon.
Good afternoon. Go ahead. What's your question today?
I've got a question and a quick comment to make, if that's okay.
Okay, please do.
Okay, so the first question is, we've got sort of neighbours living next to us who are elderly and vulnerable. Can I just ask the doctor, what precautions should we take in order to go and support those neighbours or the vulnerable people that are living close to us, in order to sort of, help them with the virus, and what advice would you give us? And then just to comment on what a lot of people are saying about the punishment and, sort of message behind the virus and what the Sheikh has already mentioned. Firstly, it's an amazing show that you're doing. I'm grateful that you have brought this to attention. And the Sheikh is doing really good advice. And my sort of penny's worth, if you like, is whether it's a punishment or whether it's a man-made conspiracy, etc., it's a moment where we have to come together, pull together as a nation. And as a Muslim myself, I have to make sure that I am doing everything that is expected of me as a Muslim and also as a citizen of this country. There's too many things going on around. People are saying it's a punishment, etc. If it's a punishment and you believe it's a punishment, then take heed from it. Don't debate, don't argue, and don't make things unnecessarily conflicting and negative in this special moment of the negative that's going around. And the doctors and the Sheikh and yourself, you're doing a great job in giving advice, and I appreciate what you've done and what you're doing today. And I hope all this is over very soon, and we can get back to a nation where we are supporting and loving and caring, hopefully in the very near future.
No, thank you so much for that. Sorry, we didn't catch your name.
My name is Afsa. I'm calling from Newham.
Asfa from Newham, thank you so much. And I really, really appreciate that point. This is a humanitarian crisis, and we really appreciate your comments there. That's really, really helpful. We heard that lovely comment there where he was wanting to support his elderly neighbours who he knows are vulnerable. Obviously, he's not going to come in contact with them because he recognised that. What other tips and advice can you give them? And I'll ask you the same in a moment, Sheikh. So very quickly, from a health perspective, is there anything he can do?
I think, first of all, that caller made a great comment, actually, about religious side of things. And coming to the how you can look after your neighbors, first of all, depend on their needs. You can even ring them on a daily basis. If you can't ring them, and if they are struggling for shopping and things, somebody can bring some shopping and leave on the doorstep without having any physical contact. You can talk to them to 3-4 meters distance when they're on the doorstep. You can have a chat with them 5-10 minutes a day because the loneliness is the biggest issue as well with elderly. They're living alone.
We've heard about people on balconies, haven't we, talking to each other, or just like last night, for example, when everyone saluted the NHS, they just came out of their doors, maintained the social distancing, but were doing that.
So people, the other way they're doing it as well, they're double packing the shopping in the shopping bag and in a bigger bag which is covering the smaller bag, and they leave it on the doorstep, and they can just pick up the smaller bag so that it's not been in contact with anyone else, and then take home. Of course, get rid of that as well, and then wash their hands so that the least contact from outside.
And I like your tip about the main thing is get in contact with them. If you happen to be next to each other in a garden or something, talk over the fence, but at least get some form of contact. And Sheikh, I'm sure you'd probably say the same.
Absolutely. I mean, from the principles of our religion, the best of mankind is the most beneficial to others. So think about others. This is the
fact
time
that he was doing that was fantastic.
Absolutely. I mean, this is the time for us actually not to be selfish, only thinking about our own safety. It is exactly what the last caller was saying. What is it that we can do to one another?
Great. Well, we'll just go to some more calls we've got on the line. So, hello, good afternoon. You're through to the show. What would you like to ask?
For you as well. It's Muhammad Asim from London.
Hello there. Yeah, what would you like to ask?
People call Corona as a punishment, but it's a blessing as well.
Thank you very much indeed for your comment. Could we have our next caller? Hello, good afternoon.
This is a very good program, and you are doing well, our Sheikh and Dr. Saab. And there is a good question regarding the children can play in the garden. It is my question, which already I hear, and it is permissible to children go and play in the garden.
Okay, thank you very much. Do we have another caller?
I have a little suggestion, if you don't mind me. I'm asking to the Sheikh Abu Hanifa.
Okay, go ahead. If you can keep it quite short, that would be great, but please go ahead.
Coming from Islamic point of view, there is a hadith in one of the hadith collections which actually mentions that this particular ta'oon has been spread by jinnat, is authentic narration. So, asking Abu Hanifa, is it good to read Alif Lam Mim Sajda a lot of times? Alif Lam Mim Sajda Surah Tanzil.
Okay.
Obviously, from Islamic point of view, we believe in the authentic narrations, even though we can't see the jinnat, but we believe in this particular thing. So, is it good to read Alif Lam Mim Sajda, those who are affected with it?
Okay. Thank you very, very much for that. I just want to answer that one, if I may. So, Sheikh, if you would like to maybe just give us your take on that.
General dua, any supplication, inshallah ta'ala, is very important, and it is, the time for it. If we believe that this test came from Allah subhanahu wa ta'ala, Allah subhanahu wa ta'ala is able to lift it. So what is it that we can do for him? The best thing is dua, supplicate, ask him, beg him, plea in front of him, seek forgiveness, and and we as a Muslims, one of the things that, our Prophet Muhammad sallallahu alaihi wasallam suggested to us, one of the things that can lift afflictions that come from Allah subhanahu wa ta'ala is donation. So maybe donation here, it could be time, There is a lot of people who are sacrificing with their time actually to benefit their community. Okay, emotions, as we were talking about a while ago. Okay, ask about other people. Take all the precautions, but ask about your neighbors. There is people who are in need of that. So this is one of the things that we believe be one of the means that Allah subhanahu wa ta'ala lift the afflictions. But particularly, the question which came, okay, this came from jinn, from a hidden, sources and so on and so forth. We say no. This is not something new for the humanity. We've, people have faced crisis, over generations from the beginning of time.
If you don't mind, I'm just going to move on quickly because we've got a couple more calls in. I'd really like to get in as many. So again, if we can keep the answers really short, that'd be great. And again, for you watching, please keep these calls really short as well. We appreciate it. So let's get some more calls. Who's calling this afternoon?
Hello, Assalamu alaikum.
Hello, Dr. Hina. What would you like to say?
Dr. Hina here. Thank you very much for the very useful show. I am also working off and on in the front line at some hospitals, and as far as medical side of it is concerned, I do appreciate the patients. They are trying to be more patient, and especially the ladies who are pregnant and who are expecting their babies, and so they are trying to see the positive side of it. There is panic as well. As far as the spiritual side is concerned, because you are discussing both the points today, I would say, as we were talking among some of our colleagues and just had a bit of coffee discussion, is that rather than looking at it as a punishment, it is more like a mercy from God, because He has given us an opportunity to really look at the things which perhaps were a bit ignored in the past, like looking after more each other. Even our own children who are living in other places, who have got married and gone, they are now thinking more that, oh God, we had opportunity to see our parents on weekends, but we were so busy with our other activities, we never went, and now we can't go and see them. So they are really regretting, and they are making plans that in future, when things are normal, they will see us more. And also that turn to God a bit more. We were trusting too much on science, and we thought we don't need God or faith anymore. So we need a balance between our faith as well as the reality.
And you're quite right. It's going to be a very, very different world. And hopefully, as you say, this will bring everyone back to basics and renew people's faiths and their attitudes to other people. I'm just going to take one more call before we come back to our doctor and Sheikh. This is somebody from London. So a very good afternoon to you. What would you like to ask?
Hi, good afternoon. I would like to ask a question in terms of coronavirus. As we know, it spreads from inhaling or taking in someone's either the phlegm or something that comes from the mouth. I'm just wondering if it's the same with smoking. If one smokes and inhales someone else's smoke, can they catch the virus in that way?
So much indeed for that. We appreciate it. So, Doctor, really simple question there. Second-hand smoke from somebody in a smoking environment, are you vulnerable to getting coronavirus from that?
First of all, try not to smoke, especially in this environment.
Especially because you're touching your face all the time, aren't you? Yeah.
I'm not 100% sure about it, but I'm assuming that, yes, if anything coming out of your lungs, if you're inhaling it, then yes, it can contain the particles and it can be a risk.
Great. What I'd like to, we've literally just got 1 minute, so what I'd like very, very quickly is for you to wrap up with your main point that you'd like to get across with today. After all the news we've had, what would you like to say?
I think one thing, we are talking about washing hands and everything. I think everybody knows that. I think from NHS point of view, I would say use the service if you really need it. There are loads of information available on the websites. Read it. Call your GP surgery when you really need some advice which is not available over the websites and other avenues. So because NHS is at the quite a crunching point actually right now. So if you use it we have to change our habits.
So basically it's there for you, but use it wisely. Thank you very much. And Sheikh, what would you like to finish up on?
I would say to people, be moderate. It is a serious matter. take the best of precautions and turn to Allah subhanahu wa ta'ala, that Allah subhanahu wa ta'ala lift this away from us, and make a lot of du'as and supplications that Allah subhanahu wa ta'ala save the humanities in total.
Fantastic. And again, Doctor, just very quickly, top tips if regarding isolation and self-isolation. What are your top tips with that?
Well, if you've got symptoms of cough, fever, and you're not a high-risk patient, then 7 days isolation. If somebody in the family got the symptoms, then it's 14 days isolation. If you're high risk, the self-isolation is 3 months advised at the moment. Again, wash your hands, keep yourself less as possible in contact with others.
Thank you so much indeed. Well, unfortunately, that is all we have time for. I'd like to thank our guests today. Again, General Practitioner Dr. Imran Gohar, who's taken time out of his surgery to come to us here today, and Sheikh Abu Hanifa. Again, thank you so much indeed for joining us on today's programme. Now, once again, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. Again, thank you so much indeed. For more information, you can go onto the coronavirus website. That's 111.nhs.uk/COVID-19, and you can see that address on the bottom of your screen. That's the place to get the best and most up-to-date advice. Remember, if you have symptoms that worsen or have symptoms lasting longer than 7 days, again, that's the moment you should call NHS 111. Or if you would like to get in touch with us, then you can always at any time email us at healthshow@islamchannel.tv. Again, thanks for watching, and I really, really hope you stay safe and take all the necessary precautions that have been given to us by the National Health Service. Goodbye for now.